Hello, everyone. I'm a geriatrician, which means I specialize in caring for older adults. You might wonder why someone who works with elderly patients is talking about pregnancy medications. Well, as a doctor, I felt I had to speak up about some very concerning claims that were recently made about Tylenol use during pregnancy. These statements have the potential to harm pregnant women and their babies, and I believe the public deserves to hear the medical facts. Before we continue, I want to encourage you to look at the research studies I've included in the description below. These are the actual scientific papers that doctors and medical organizations around the world use to make recommendations about medication safety. When the highest level of government makes medical claims that contradict decades of scientific research, it affects everyone. Pregnant women might stop taking safe medications when they need them. Families might make decisions based on fear rather than facts. As healthcare providers, we see the real consequences of medical misinformation, and it breaks our hearts. Recently, there have been statements suggesting that taking Tylenol, also called Acetaminophen or paracetamol, during pregnancy causes autism in children. The claim urged pregnant women to tough it out instead of taking this medication for pain or fever. This advice is not just wrong, it could be dangerous. Let me be clear and gentle, but firm. There is no scientific evidence that Tylenol causes autism. None. The medical community worldwide continues to recommend Tylenol as the safest pain relief option for pregnant women when used properly. I know research can sound confusing, so let me break it down in simple terms. Some studies have noticed that women who took Tylenol during pregnancy had children who were later diagnosed with autism or attention problems. But here's the crucial part. Just because two things happened together doesn't mean one caused the other. Think of it this way. People who carry umbrellas are more likely to get wet. Does this mean umbrellas cause rain? Of course not. People carry umbrellas because it's already raining or about to rain. Similarly, pregnant women take Tylenol because they have pain, fever, or illness. And sometimes these underlying conditions, not the medication, might influence a child's development. The best designed studies, the ones that account for these other factors, have found no link between Tylenol use during pregnancy and autism. A major study published just this year looked at over 2.4 million children and found no increased risk when they properly accounted for family factors. Medical organizations globally, from the World Health Organization to the American College of Obstetricians and Gynecologists, all agree Tylenol remains the recommended choice for pain and fever relief during pregnancy. This isn't just American doctors saying this. Medical authorities in the UK, Canada, Australia, New Zealand, and throughout Europe all maintain the same position. Dr. Arthur Kaplan from NYU, one of the most respected medical ethicists in the country, called the claims against Tylenol the saddest display of a lack of evidence. The UK's National Autistic Society condemned the misinformation as dangerous and anti-science. Pregnancy isn't always comfortable. Women experience headaches, back pain, and fevers. These aren't just minor inconveniences, they can be serious. High fever during pregnancy can actually harm the developing baby. Severe pain can cause stress that affects both mom and baby. When pregnant women have pain or fever, they need safe treatment options. Tylenol is often the only safe choice. Other pain medications like ibuprofen or aspirin can be dangerous during pregnancy, especially later in pregnancy. So when we tell women not to take Tylenol without providing safe alternatives, we're essentially telling them to suffer unnecessarily. The truth is, not treating pain and fever during pregnancy poses known, documented risks. High fever in early pregnancy has been linked to birth defects. Untreated pain can lead to stress, sleep problems, and depression. all of which can affect the baby's development. Meanwhile, Tylenol has been used safely by millions of pregnant women for decades. If it caused autism, we would see clear patterns in the data. We don't. If you're pregnant and need pain relief, here's what doctors recommend. Use the lowest dose that helps your symptoms. Take it for the shortest time needed. Follow the package directions. Don't exceed the recommended dose. Talk to your healthcare provider if you need to use it regularly. Don't stop taking it if your doctor has prescribed it for a specific condition. Remember, taking no medication when you need treatment isn't automatically safer than taking a medication with a proven safety record. When influential people make unsupported medical claims, real people get hurt. We've already seen pregnant women in emergency rooms, in tears, asking if they've harmed their babies by taking Tylenol for a headache. We've seen women suffering through fevers because they're afraid to take medication. This breaks our hearts because these women are experiencing unnecessary fear and potentially unnecessary suffering based on claims that have no scientific support. Science never stops. Researchers continue to study all medications used during pregnancy to make sure they're as safe as possible. Some studies are looking at whether very high doses or very long-term use of Tylenol might have effects we haven't noticed before. This ongoing research is normal and healthy. It's how we make sure our recommendations stay current. But ongoing research doesn't mean we throw out decades of safety data. It means we stay vigilant and adjust our recommendations if and when new evidence emerges. Right now, that evidence strongly supports Tylenol's safety when used as directed. As a doctor who has spent years studying how to keep people healthy, I want to leave you with this. Trust your healthcare providers. We base our recommendations on the best available scientific evidence, not on political statements or social media posts. If you're pregnant and have questions about any medication, talk to your doctor or midwife. They know your specific situation and can give you personalized advice. Don't let fear-based claims override medical expertise. The research is clear, the medical consensus is strong, and the safety record speaks for itself. Tylenol remains a safe and important option for pregnant women when used appropriately. Please don't let misinformation prevent you from getting the care you need. Remember to check the research links in the description below. Your health and your family's health deserves decisions based on facts, not fear. Thank you for listening, and please, always consult with your healthcare provider for medical decisions.